Cutting the Fat with SNAP, Part 2. 2 days ago, we began this series about the public hearing that was held in Greenville County to address Governor Haley, Secretary Templeton, and the Secretary of DSS desire to change the food stamp program to ban certain unhealthy choices, for example, sugary drinks like soda and candies and cookies. And in the first part, we talked about the meeting itself and the good, the bad, and the ugly of the meeting. And I mentioned that I was going to put together my position on what is being proposed. So that's what today's about. The governor and Director Templeton have stated that obesity is a major problem in South Carolina, and it is. 67% of South Carolinians are obese. And Director Templeton keeps mentioning that she has been tasked with fighting obesity. And like I said in the last video, I'm not sure who tasked her as the head of the Department of Health and Environmental Control. But they're talking about we need to address obesity. And as the first step, or as the easiest step, they were talking about people on food stamps buying drinks and candy. And they said, you're able to go buy what you want, the government's just not going to subsidize your unhealthy choices. And that's one current theme that you hear a lot for people who say, yeah, they shouldn't be able to buy the soda pop and candy bars and cookies and cake. So the question is, would the best approach to fighting obesity in South Carolina be to restrict what foods people on food stamps can purchase? So I want to look at that in a couple different ways. Let's throw some statistics out there. We said 67% of the people in South Carolina are obese. 20% or 20 to 25% of South Carolinians receive food stamps. That leaves 40-some% of South Carolinians who would not be addressed, who are obese in this state. It seems like we're only targeting a small group of people. Now, I know the argument is the government's not subsidizing those other 40-some%, but I will have to hasten to say, are we addressing people who receive Social Security? People who are veterans, people who are on the government payroll? That's taxpayer money being used for people who could buy the soda, go to McDonald's, and so forth. Now, we should approach obesity. That is a major issue. But there's an issue. I don't think this is an effective way to address obesity. A couple of the speakers from organizations committed to healthy lifestyle choices, made the point that, let's say SNAP benefits, we were given an exemption and we were able to say you can no longer buy soda pop and candy bars and ho-hos with your food stamps. That's not going to necessarily make people more healthy, because they could still buy with other money. Now you'll say, yeah, but the taxpayers aren't subsidizing it. So is the issue obesity, or is the issue taxpayers subsidizing? Beyond that, are we saying they can't buy soda, but they can buy juice? We know that juice, in many cases, has as much, if not more, sugars. What about they can't buy cookies and cakes? Can they buy healthy potato chips? And a couple of speakers brought up this question about what is healthy. Is our food actually healthy? There were people who mentioned that of the additives, there's a big fight about Monsanto and the stuff that's being put into our foods today, and maybe the foods in general aren't healthy. So I'm not sure, first of all, we're addressing the obesity problem in a comprehensive manner. And just not eating sugary drinks and snacks If you're still eating processed foods, if you're still not eating the best health choices, you're not helping. And then isn't exercise a part of that? Isn't there some need to be doing exercise? And where do we get that? I think both of the groups that were in the healthy living side stressed the fact that there's a couple things that need to be done. Education, first of all. And this was a big theme throughout the whole meeting, education. And as we did our experiment 2 weeks ago about buying healthy at the store, one of the things we talked about was that a lot of people don't know what's healthy, aren't aware of how to prepare things, don't have basic knowledge of cooking ways of cooking that would be more healthy. So education, access to food. Now that's the other thing. People kept talking about a food desert, and I didn't know what they were talking about at first because I live right across the street from 3 different grocery stores. I have plenty of choices. But food deserts are areas in the state and in the country where there are not a lot of healthy choices nearby. You can go to northern and southern Greenville County where the closest grocery store is miles away. And if you have no transportation or limited transportation, the closest thing you're going to get is a convenience store or a small mom and pop store that doesn't have a whole lot of healthy choices. How do these folks eat healthy? And then we talk about the cost of eating healthy. Like we did with our experiment, we found that for a family of 4, just an average look at this, it would cost $100 more than what the average family of 4 received in food stamps. Where's this $100 coming from? And that's not going completely super healthy. And if you live in a food desert, your costs are going to be higher. So I think if we're honestly wanting to battle obesity in the state of South Carolina, we need to improve education. I would suggest, rather than penalizing people for buying an unhealthy item, we should incentivize them for buying healthy. What about this? What about after they go shopping and they purchase healthy choices, they get a bonus? So that when they buy apples and oranges and have to pay extra, that they'll have some extra money in their food stamp bank to be able to buy more apples and oranges. It will encourage them to buy apples and oranges and healthier choices. Rather than saying we're going to take away or we're going to tell you you can't have this. You know, one of the funny things that I found was interesting in this discussion was there were a lot of people talking about rights, Americans' birthright to choice. And if I'd not focused on what particular topic they were talking about, I would have thought I was in a room full of Tea Party members who talked about the American way and having choice and being able to make decisions for ourselves. You know, I mentioned this last video about the school lunches and how people were upset because the government was going to tell them what the schools could serve. But that's exactly what we're doing here. I applaud the initiative to obesity, but I think limiting what particular food can be purchased on food stamp is more about placating misguided people and doing feel-good things than an actual program to help reduce obesity across the state. Education in school. Look, when someone signs up for food stamps, there should be some kind of an education process. And there should be ongoing education for people to continue to learn how to eat more healthy, how to live more healthy. But I tell you what, there's a huge business opportunity in this. And since the state is really big on business and really big on helping business, mobile food vendors, there's a couple of fruit and vegetable mobile trucks in the area. I think Spartanburg has one where they go to the rural areas, to where the food desert is, and they can provide less expensive fruits and vegetables to people where they can't normally get them. Encouraging business to locate in these areas, encouraging big grocery stores, Walmarts, somehow incentivizing them to work to bring the cost of healthy food down, and maybe at the same time raise the cost of unhealthy food. I think this is a better way to address obesity in South Carolina. And I think the problem, one of the biggest problems with this approach is it selects a group of people who have really no power or very limited power and puts the stigma of obesity, it puts the stigma of you're taking my money and spending it unwisely. Even though I might take my money and spend it unwisely, you shouldn't do that. And as we heard in this meeting, there are a number of people who were working, having paid taxes all their lives, or paying taxes now, who were receiving food stamps. So it wasn't just your money or my money. They were paying taxes too. So I would urge the governor and the directors to rethink this. Listen to the Living Well community about a more comprehensive program and less one that targets a vulnerable group. All right, you can listen to us on canIGetAWordIn.com. You can also go to iTunes, subscribe to our podcast channel at Another Voice with Eric and Jason, or go to Facebook at Another Voice with Eric and Friends. Until next time, get out there and make a difference in your community.